Okay, so hello everybody. I've got some outlines for you today, so we're going to just pass these out to you. We're going to talk a little bit about the PSR today. And let me ask you this, by a show of hands, who thinks that the periodontal assessment and the charting and the probing is one of the most important aspects of the dental hygiene treatment? Okay, so pretty much 100%. So according to the American Academy of Periodontology, periodontal disease is the leading cause of tooth loss in adults. In fact, some forms of periodontal disease affects almost 75% of all Americans. So gingivitis is included in this too. So we all know that it's not just about losing teeth, that periodontal disease is not just about losing teeth, that it affects more than just your mouth, right? So do you guys know what else it might affect besides just your mouth? Any links or connections between periodontal disease and anything else? Yeah?
There's a strong correlation between patients with diabetes and periodontal disease.
Exactly. So diabetes is one. So
Isn't heart disease another one?
Heart disease, yep. Anything else? How about I'll give you a hint. This is something that only women, can only happen to women. Pregnancy. Well, it's close, but you're thinking hormones though, right? Hormones, so pregnancy. So it can have pregnancy complications also. So we've established that it's not that periodontal disease doesn't just affect the mouth only. It has a myriad of other connections and links, right? So now that we've established that, how vital it is to the appointment, overall appointment of the person, let me ask you this. Do you feel, or how many of you feel, that traditional probing takes forever? Okay, so pretty much 100% of you. And it does. So, you know, what if I told you that there was a way to cut the time but not compromise standard of care? Do I sound like an infomercial? Yeah. Well, and I don't mean to, but it's true. I mean, if I told you that there was a way to probe the entire mouth and not compromise the standard of care, would you be all for it?
Sure.
Okay, pretty much, yeah. So what I'm going to talk to you a little bit about is the PSR, which actually stands for Periodontal Screening and Recording. And it was developed by the American Dental Association and the American Academy of Periodontology. And it was developed as a quick and effective way to screen for perio diseases without all the documentation and all the actual written documentation, okay? So the first thing you'll need when you're talking about the PSR is you'll need a PSR probe. So I've got one sitting on your table, and a little bit about the PSR. What's nice about the PSR, the periodontal screening recording, is you really only need one thing, and that's the PSR probe. That is preferred. The PSR probe can be made of either metal or plastic. The ones you have are metal. They generally hold up a little better, like when you send them through the autoclave, and they'll hold up for a few more years rather than a plastic one. Now, I drew a picture of it, so it should look a little like this. On the end of the PSR probe, you've got a little mini ball, and it's about 0.5 millimeters, so about half a millimeter in diameter. It's really tiny. And then you don't have any other measurements on there except this colored area, which is 3.5 to 5.5 millimeters. So that's the colored area on there. And this is the preferred instrument to do a PSR chart on somebody. Okay, so the next thing you'll want to do is you'll want to divide the mouth into sextants, which you guys have done that before with your instrumentation. It's the same thing. You're dividing the mouth into sextants. So sextant, and you set it up like this. So it looks like a box with 6 sections. Say that 5 times fast. And posterior, anterior, posterior, posterior, like that. So same way you've done all your instrumentation all year round, it's the same thing. So each of these sextants are going to be probed the traditional way. So you're going to go around each tooth, do that walking stroke that you've been taught, individually around each tooth, mesiofacial, facial, distofacial, distolingual, lingual, and mesiolingual, all 6 surfaces, each tooth, but you're not going to record each measurement. Instead, these sextants are going to represent a certain code in that sextant. So as you're measuring, and we'll talk about the codes in a minute, whatever code you come up with in that sextant is what's recorded only there. Okay, I know it seems a little weird right now, but we'll kind of get into that in a little in a minute here. So let's talk about the codes so you understand what they are. We have essentially 5 different codes. So 0, 1, 2, 3, and 4. There also is a code asterisk. It's not really called code asterisk, but, and we'll talk about that at the end, but that's something you add to the sextant if there's certain conditions that apply. So code 0 is essentially someone who has nothing going on their mouth. Healthy, there's no bleeding. When you probe, you don't even come close to the dark colored part here. It's usually black, by the way. So you can still see the black part's completely visible, and there's no bleeding in that sextant whatsoever. Okay, so generally a healthy mouth. Kind of what you guys have been working on with each other. I doubt you've really seen a lot of bleeding unless you're probing that mouth 80 times like you've been told. The next one is code 1. Code 1, when you probe in the sextant, on the tooth in the sextant, you'll also be able to see all the black part. Okay, none of this, the colored part will be covered. However, there could be some bleeding in that sextant somewhere on a tooth. So, and also you'll find no defective margins, no calculus in code 0 or code 1. Okay. Code 2 is when you start getting into some concerned areas or some areas of concern. Code 2, you can still see the colored part of the probe, but there might be bleeding present, but there is always usually calculus, either supra or subgingival calculus, or there's a defective margin, like around an old restoration, something like that. So that's code 2. Code 3, when you're probing, the colored area is only partially visible. So you're getting a reading somewhere between 3.5 and 5.5 millimeters. And there might be bleeding, there might be calculus, but the only qualification to be a code 3 is that you have to be probed in this, it will go in this colored area. If you get a 3 in a sextant, say you're going all the way through and you're doing fine, getting code 1s, code 0s everywhere, and maybe down in sextant 4 you get a code 3. If you get a code 3 in that sextant, you will probe and record each measurement just in that sextant. Okay, so if you're getting something between 3.5 and 5.5, you're going to probe this entire sextant, and you're going to record everything in there.